So welcome to Fertile Forward. I'm Sadie Minkoff with Sage Acupuncture, and today I am thrilled to be speaking with Kelly Boyd, who is a licensed psychologist here in Austin, Texas, and who specializes in reproductive trauma. So before I begin, I do have to say that I have been thrilled to work closely with Kelly for many years, and she has really changed the lives of our mutual patients. So I'm very excited about that. And so welcome, Kelly.
Thank you so much, Sadie. I appreciate the opportunity to be able to share with the community and with you, and have treasured our work together over the years, for sure.
Absolutely. So would you mind, just as a way of introducing your work, sort of explaining what reproductive trauma is and how you work with it?
Absolutely. So it's most people know the word trauma and associate trauma with first responders or war or something, very, very traumatic. And trauma with regards to the reproductive process is very similar. When we think of the word trauma, we think of something that affects us physically, emotionally, relationally, spiritually, and financially, which tend to be all aspects of our being. And so people often will ask me, what do you mean by reproductive trauma? Well, when we have something that doesn't go as planned in any part of the reproductive process. So that's the whole spectrum from, endometriosis or difficulties, during the early reproductive years, to attempting to get pregnant, any part of the fertility process, assisted reproductive process, pregnancy, high-risk pregnancy, postpartum mood disorders, any type of perinatal grief and loss, and all of that. All of those things, the thing that they share in common is that it wasn't supposed to be this way. And it can affect us physically, emotionally, relationally, spiritually, and financially. So that's how we came about with the idea of referring to this as reproductive trauma, because it does have all those aspects of how it affects us and our families.
Yeah. And I have heard that it is, in fact, one of the most stressful things people can go through, like akin to
Absolutely.
being diagnosed with a terminal illness, which I think is really surprising for many people to hear. But
Yes,
when you've walked that path, you sort of understand, like exactly what you said, that every aspect of your life is affected. And
absolutely.
really, I think also quite a personal journey, or a private and intimate one. So we don't
Yes,
usually have the same community support that we would perhaps
yes,
in some other aspect
yes.
of lives.
Yes, and it is all of that. And I also think that there's such a what I often refer to with my clients and people that I'm working with, and with the community, sort of this rising hopefulness and sinking despair, especially with fertility. Then some women that do end up conceiving, if there's a loss following all that initial trauma of trying to get pregnant, then getting pregnant, and then having a loss, that too, can be so devastating and such a private and personal journey. And you're right, many people share this information with their families and friends, and others don't. So many of the families and women that I work with feel a tremendous sense of isolation and alone. And who do we turn to, and what sort of camp do we fit into, and what circles of support are available, and do we fit? So I think that's another very interesting thing to figure out, how to get support in this community.
Absolutely. Yeah. And I think that what's interesting is once people do start to sort of talk to their best friends and things like that, everyone's like, oh, that happened to me too, or we
Right.
struggled too. And you do find out how common it is. But
Yes.
at first it feels very alone, and
Very alone.
there's
Hmm.
nobody
Yes.
there. So it's great to have resources,
Yes.
available. So I know that the phrase reproductive trauma was sort of coined out of an institute that you've worked in San Diego. Is that right?
Yeah. Yes.
Yeah.
Yes. I had the great honor of in graduate school, actually working with doctors Martha and David Diamond, as well as Dr. Janet Jaffe. And they were some of the professors at the school that I was at. And we started to all notice that there's something very unique about the emotional support and the therapy involved with people going through various types of reproductive issues. So we all had our own different types of reproductive trauma. They had theirs. I certainly had mine. I'm very honored to be able to openly speak about that. I did have a long history with endometriosis and fertility. Then I also had high-risk pregnancy, and then postpartum mood disorder, and then pregnancy after loss. And now I'm sort of at the other end of the spectrum with menopause. And they had their own. And we just came together and we said, there is something so unique about this treatment. And you don't treat it with like generalized anxiety disorder, and you don't treat it like general major depression. It's very unique, and it has its own intricacies with assessment and treatment. So we came together and said, we need to do something about this in the community in San Diego. And they really started the Center for Reproductive Psychology in San Diego. And then I, through a number of life events, ended up in Texas and said, I am going to continue this work here in Austin, and thankfully have had a wonderful experience with this community here and working with reproductive trauma locally.
For many years.
Yes,
right?
yes, yeah, since 2003 now.
Yeah.
So yes,
Wild.
it's been
That's
some
great.
time, and yes, it's been a wonderful,
Yeah.
wonderful niche area, and so needed and important.
That's so interesting to me how recently, I mean, yes, 20 years perhaps, but relatively speaking, in the scheme of things, that's how long it's been since we've really been recognizing this.
Yes.
And so it
Yes.
is a relatively new area of specialization.
Yes.
That you really were a forerunner in developing. Yeah.
Thank you. Yes, it's like I said, it's been an honor. And then everybody says, where were you when I went through this?
Right.
I will speak to many women, who have gone through fertility or had their reproductive trauma and say, gosh, I wish this was available when I was going through this. And many people don't even still know that it's available as a resource.
Absolutely. Absolutely. So I think that you have described your work as collaborative and
Yes.
interpersonal. And
Yes.
so I'm wondering if you can speak a little bit to what it's like to work with you when people come and seek help from you, and what that really means, collaborative and interpersonal.
Yes. So basically, I mean, collaborative means that whatever my clients' needs are, and again, because it's varied. I mean, everybody comes in with different issues and different concerns and different stressors. So what my job is to really invite them in for an initial intake, which is a 90-minute session, and just hear their story. And that's often the approach that I work from, is at what we call the reproductive story. And, our reproductive stories start from we're very young, of how we think things are going to go and how our lives are going to evolve and how we will have this plan. And then when something doesn't go as planned, that changes the chapters in our story. So an initial intake really will involve many times just the woman herself, but I always welcome them to bring in their partners. It's really up to them on that first session, but in that session, I'll listen for the reproductive story. I'll assess where the current stressors are. We'll discuss various different treatment options, if it needs to be individual therapy, couples therapy, group therapy, online therapy, teletherapy, and sort of figure out the modality that might work best for that couple or that individual, and then make a treatment plan. And so, that's what the initial work looks like. And then the ongoing work, really plays out from what is presented in the initial intake, but mostly an exploration of the reproductive story and how things have changed. Grief and loss, and that doesn't just refer to grief and loss through death. It refers often to, how the plan has changed and the losses that are often associated when the reproductive plans change. Losses of family, losses regarding body and spontaneity and, body image issues. There's so many different things that come up. So, Yeah, so that's usually what the initial intake looks like, and then subsequent sessions really are very open and collaborative. I mean, I work with the client to meet them where they are in the place that they are each day, each session,
Mm-hmm.
because it's often very different. As we know in the reproductive process, things can change day to day, week to week, month to month.
Right. It's a
So
roller
that's,
coaster.
yeah. And then collaborative is also collaborative with the treatment team. So what I love to do, and this is where you and I have had some connection, is to be able to assemble and discuss who is our treatment team to support this individual or family, and contact different providers so that we can all collaborate and work together for the good of the couple or the individual as a treatment team to support them.
Great. That's great. And, mentioning family and
Mhm.
community, I know that you have a vested interest in educating people about
Yeah.
this work. Can you tell us a little bit about what you offer in that regard, or what you've done professionally with educating the community and families, and as well as just interpersonally with couples?
Yes, I've had quite a bit of experience and background in private practice, but then I have also worked in integrated care, where I've worked within different OB-GYN groups. I also had the honor of working at the Women's Center, so more of a hospital-based program. And within each of those arenas, private practice, OB, and private practice care, as well as hospital, I've always been a big advocate about educating the community as well as the professionals, because so many families will come in and women will come in and say, I wish my doctor knew about this. I wish my practitioner knew about what reproductive trauma is. So I've always made it a goal to provide, whether it be CEU classes and courses for professionals, or community outreach workshops, collaborating with other professionals in the community, being able to go out and speak at public health fairs, women's conferences, any place that I can on a larger level to get this message out that women are not alone and that we can get through this together. So yes, education is a vital piece of this, so that women don't feel so stigmatized and so alone, and so, feeling as if nobody understands.
Right.
So,
And so I do think that it's very hard for some people to come and even talk about this with anybody,
yes.
and sort of get out of that isolated place.
Mhm.
So the telemedicine piece is really intriguing to me, because
Yes.
you can do that from the comfort of your own home, right?
Yes.
Yeah. Can you just tell us a little bit about how that works, and what you offer there?
Absolutely. So telemedicine and telemental health, it has a number of different names, but basically it is a connection that is a secure, HIPAA compliant, confidential connection, where you and the person, or myself and the person or the family, this is wonderful to do with family therapy as well, because we can connect people from all over. But basically I reach out and send a link for people to connect on a secure platform, and we will conduct therapy over the internet, face to face, screen to screen, so we can see one another. Or other people even have a hard time with that, and they prefer the telephone. So I'm able to provide telephone therapy, video chat platforms such as what we are doing right now, in the comfort of their own home. So, women can be in their pajamas and be in their safe space, and don't have to commute, and don't have to fight, whatever obstacles there are in terms of transportation or childcare, or, all the
Other
number of
things.
barriers that come up with trying to get to an appointment.
Yeah,
So
great.
it's been a wonderful opportunity for people to reach out and get help at any time. And I also offer them in the evening hours too.
Mm.
So for working professionals, that's another nice advantage, to be able to do it on a lunch hour, or do it once they get home from work.
So
So
making it really accessible.
it's very accessible. Yes.
That's wonderful. So is there one thing, if you could tell people struggling with fertility, what would that one thing you would want them to know be?
They're not alone. They can get through this, through the ups, through the downs, and not be going through this alone. That there is professionals, there is a community that is available, there are resources that are available, and that it often can be on again, off again. You might have some good days, you might have some bad days. You might have some good months and you might have some down months. And that roller coaster of emotions can be tough to do alone. So my biggest thing that I just encourage all women and families to do is seek help, seek support, know that we can, be with you in this process, and that doesn't have to be so isolating.
Wonderful. Beautiful. So if people want to get in touch with you and work with you, how do they go about contacting you?
Yes, they can contact me on my office number, which is 512-733-5224. You can also reach me through email, which is drkellyboyd@yahoo. And there's also some information online. My website is online, which is drkellyboyd.com. But I'm happy to receive calls and emails to schedule people. When people do reach out to me, I try to get back to people within 24 hours, unless it's a weekend, then I'll, the next business day. But
Perfect.
yeah.
Great. Well, thank you so much for taking the time to talk to us and for all
Absolutely.
of the
Thank
wonderful
you.
work you're doing. Yeah, absolutely.
Thank you so much, Sadie, and all the wonderful work that Sage is doing.
Yeah, thank you. Take care.
Thank you. You too.